And I want to invite next Antonina KUMKA from Protez Hub to talk to us about amputee trauma here in Ukraine, about challenges and successes. Welcome.
Good morning, dear colleagues. I'm honored to be here today and speak with you about the challenges and successes of Ukraine's prosthetics and orthotics industry. I have a difficult task ahead of me to talk about a span of over 10 years of prosthetics and orthotics development in Ukraine in just 15 minutes, but I'll do my best. Let's try it again. It's not reflecting. Oh, there it is. It's just slow. Okay. So my name is Antonina KUMKA, and I'm the CEO of Protez Hub, among other things. And as you can see, none of those are related to prosthetics in any way. So I'll address that during my presentation. I'll tell you a story of how I came about to be part of this field. Protez Hub is an independent initiative that has been transforming and developing Ukraine's prosthetics and orthotics industry since 2014. We're not another prosthetics and orthotics center, and we have no commercial conflict of interest in the field. We started our work back in 2014 when Russia occupied Crimea and parts of Donbass. That was the first time when combat trauma presented a challenge to Ukrainian professionals and Ukrainian system. And at the time, the government was paying only $750 per prosthetic limb. There was no such thing as a multidisciplinary approach to amputee care whatsoever. Professionals were trained on the job, and there was no formal education for them. They had no foundational knowledge of health sciences, and access and availability of technology was quite minimal. So at the time, something had to be done to improve the situation. I reached out to John Batsdorf, who was the president of ISPO USA, and now is the director of Protez Hub, among other professionals. And we organized missions to Ukraine that were multidisciplinary in nature, that brought new technologies and new techniques to Ukrainian professionals to ensure sustainability and systemic changes right there in Ukraine. The whole point of such exchanges and such approach was to make sure that we have a system that delivers quality amputee care, quality prosthetics, and follow-up for amputees right in Ukraine, close to where they reside. So some of the things that were introduced and implemented at the time were the technologies such as multi-articulating hand prostheses, or they're also known as myoelectric or bionic hands, as well as new techniques in socket designs. Some of them were in hip disarticulation and other things, as well as activity-specific devices like sports prostheses, running prostheses, activity devices for upper limbs, and so on. So all of that was gradually becoming available in Ukraine and became a routine by about 2017. So around 2017, there was no longer any need to bring Ukrainians out of the country for prosthetics at the time. We also helped the first Ukrainian Invictus Games team to win their first medals back in 2016, I believe. So the system was evolving successfully, and many stakeholders played a part in it. It was truly a collaborative effort, but it required a driving force, and we happened to be that driving force. By the time Ukraine was hit with the new challenge in 2022, Ukraine's prosthetics and orthotics industry was already robust and capable to withstand the challenge. If you think back to beginning of 2022, nobody was even talking about prosthetics at the time. Everybody was focused on just delivering aid, procurement, sending tourniquets, and other things like that, right? For about 7 or 8 months, there was no talk about prosthetics. Why so? Did amputees not exist? Were there no injuries? Were the first soldiers not impacted by the war? Yes, they were, but the system was handling the situation. That was the proof of the success that we achieved through systemic changes before 2022. So in 2022, Ukraine was faced with the new challenge, and of course, there were some things that changed in prosthetics and orthotics as well. In the second half of 2022, the manufacturers started facing issues with supply chains, and some polytrauma occurred that was not very familiar to Ukrainian professionals, and honestly, to the most experienced professionals abroad, including the US, because those trauma were very complex. So we stepped up, and first of all, we launched the Amputee hotline. We worked tirelessly together with the Ukrainian government to ensure that legislation was up to date and was meeting the needs of Ukrainians who required prosthetics at the time. And we also worked together with such organizations as Prosthetica, OSER, Nova Ukraine, and others who were willing to join in the effort to organize professional exchanges to introduce new technologies and techniques, such as direct socket technology, as well as the use of different socket designs that were not previously used, and the routine use of stubbies for bilateral amputees. So to date, there are about 20,000 new amputees. Some are as a result of the war, both civilians and military, but not all are the result of the war. They're trauma amputees in general. The wait times to receive prosthetics in Ukraine today is around 2.5 to 3.5 months, and that is for both lower limbs and upper limbs. And there are, of course, cases when it takes longer because the trauma can be really complex and the patient needs a longer time for rehabilitation. But those are rather exceptions than the norm. Then there are 100 plus P&O centers, and the number is growing. So you may hear more about some of them than the others, but you need to know that there are over 100 of them across Ukraine. And as Vasil Strilka was mentioning, there is no need for more prosthetic centers or rehabilitation centers. There is a need for quality and ensuring that qualified professionals work in those centers. So next, 95% of devices are government funded. The government program today works really well. Even at the beginning of 2022, a military could receive a prosthesis that cost just under $60,000 US per one limb. And today that number has reached around $100,000 US. So the process is quite straightforward. The person submits a paperwork. In about 5 days, the paperwork is being reviewed, and then the person receives a confirmation that they can go ahead and decide which service provider they want to go to and receive that device. Based on the surveys that our organization regularly runs, and we're so hung up on data, we always want to know what happens in the field. We ask different stakeholders for different types of information. Patients are not excluded from that. So we regularly run the surveys of the satisfaction with the services and the products. And the numbers range between 88 and 92% on an ongoing basis. So generally, patients are satisfied with what they get in Ukraine through the government-funded program at those different centers that I mentioned previously. So what has our organization done to help the Ukrainian government ensure that Ukrainians receive quality care right where they reside, including the follow-up and repairs through the government program? We have launched an amputee hotline in 2022, and our consultant on the hotline is Andriy. Andriy is a war veteran who lost an arm, a leg, and a vision. He is a very knowledgeable individual. He's been through the process himself. He studied the legislation, and he provides an honest and unbiased consultation to the callers. It could be amputees themselves. It could also be their families or friends. We have established the first in Ukraine online platform that helps professionals learn more about different approaches to amputee care, which is available freely to anyone who wants to access it, and that combines all the best practices from around the world. It also contains information for amputees and their families so that they are not lost in the flood of information that exists today. Because we aim at sustainability and systemic changes, we help the government of Ukraine with advocating and seeing through 9 policies that help the amputees receive better care, and have developed 4 standards. I'll talk about it later. In the process of the trainings and in the process of all the things that we have organized, we have also introduced about 8 new technologies. Our goal is not the number of amputees fitted. We never run that number, and we never present it as our achievement. Instead, we talk about how many professionals we have trained today. Because again, it's all about sustainable changes. And to date, we have trained around 8,000 professionals from all across Ukraine, from different parts of Ukraine, from different facilities, both healthcare and prosthetic facilities. We've done it in partnership with international stakeholders and international partners from many different countries, and with the support of our donors and sponsors. That was a short overview. I only have 15 minutes, so I could play a million of those. Not a million, under 20,000. So if you ever hear a number of 100,000 amputees in Ukraine, just think logically, it's impossible, because the acting frontline army is just around 200,000. That would mean that half of our active army is with a limb amputation. That's not a true number. I know it fluctuates around. So you've just seen a video of different types of prostheses that are possible in Ukraine today with government funding and without delays. One of the leaders all of those prostheses that were shown were done at Protez, which is a state prosthetic facility. And now the standards. This is something that I personally most proud of, and I want to share it with you, of course. I'm often being asked, why did you have to go into standards now when the country is in crisis? My answer to that, now is the time, because Ukraine will see more amputees, and those amputees will require care for the next decades. And that care better be quality care, and it has to be up to a well-developed standard. So when we thought of that, we realized that that is the highest degree of sustainability and systemic approach. So the first standard that we have developed together with partners from ISPO, everybody knows what that is, International Society of Prosthetics and Orthotics, American Board for Certification in Prosthetics and Orthotics, Ukrainian Physical Therapy Association, Patients of Ukraine through War Trauma Rehabilitation Initiative, and thanks to the support from the Swiss government. We were very lucky to have the Ministry of Health, Ministry of Social Policy, and the Ministry of Education to be super supportive of this and be on board every step of the way. So the prosthetist-orthotist National Professional Standard was developed in 23-24 and was implemented at the time. As a result of that standard that basically set out the criteria for professionals who work with patients with amputations, we were able to certify 34 CPOs who were already trained before in different capacities, but also had a lot of experience. They had many of them had over 10 years of experience, really. We offered them the fast track to getting the certification. They took it. They passed the exam, which is what Pan Linchevsky was talking about. We engaged the international community to conduct the exam to ensure its integrity. So it was international experts who were conducting the practical and theoretical exam, and all of these professionals passed it. And here is a quick shot of what the exam looked like. Of course, we need a new generation of professionals. So the next step was to ensure that we have that. We started working on the educational standard. The Ministry of Education helped us with that, and together with the Jönköping University, which is the leading university in Europe on prosthetics and orthotics education, together with Prosthetica and American Board for Certification and representatives from the Washington University, with the support of Nova Ukraine, we were able to develop this national standard. In 2024, 4 programs were launched at 4 universities. So they are now in their 2nd year of preparing the new prosthetist-orthotist right there in Ukraine. Are they perfect yet? No. We are supporting them every step of the way. We're helping them achieve the level of education and the level of instruction that we would like it to be. So we help them with engaging international instructors where necessary, developing different instructional materials, among other things. And one of such supports is also the Train the Trainer program that we do with Jönköping University and organization Patients of Ukraine. What it does is that it prepares the instructors at the programs to deliver best possible education to the future prosthetists, orthotists. So what they learn from Jönköping is how to deliver instruction, so pedagogical skills, how to deliver assessment, so that that assessment is transparent and accurate, as well as how to run clinical practicums. That is also very important in the prosthetics and orthotics world. And one of the most recent standards that is still being in the final stage of the implementation by the Ministry of Health is the standard on rehabilitation of persons with amputations. This is probably the biggest project in terms of the length of time it took to develop it, 2 years, and we worked so hard on this document. And Ukraine is actually so lucky right now in a way that it can grab all of the pieces of information from all the different prior developed documents around the world and create its own perfect document. So something that didn't work, we don't want it. We'll take what worked and put it into place. So that's what we did with this standard. The working group was working together, carefully selecting what goes into it, and very shortly, this standard will be implemented. To prepare the teams around Ukraine, we partnered with UNDP, and now are running the preparatory courses for professionals from different hospitals. Those courses are run on the basis of Ministry of Health Centers of Excellence, and we are about to train about 300 professionals, physiotherapists, occupational therapists, doctors of rehabilitation medicines, as well as prosthetists, to abide by the new standard that's going to come out. We don't want them to be in the hot waters when it comes out, so we decided to give them a chance to understand what it's like. Sounds too perfect, right? Yeah, there are, of course, challenges and needs. So what Ukraine needs today is the following in terms of prosthetics and orthotics: further development of formal P&O education, support of those programs, and support of professionals. Segregation of duties in prosthetics and orthotics and between clinical professionals and technicians. It's one of the biggest issues today that impacts quality. So if you go to a professional who is about to take care of your health, you want to make sure that professional is well trained. You want to know that that is the case, and you want to be sure of that. In Ukraine, that is not the case yet, and unfortunately, the local providers and those who come in internationally, they hire unqualified staff, and they put them to work with patients. And we encourage the government to change that rule. Next, we need to improve the government reimbursement system, base it on the manufacturer pricing rather than the distributor pricing, so that it's not, so that it is effective. Improve patient pathway and e-systems integration between the Ministry of Health and the Ministry of Social Policy, and improve the quality control of P&O services and fabricated products. This could be achieved through fair competition and transparent patient complaint process. One more thing that I want to mention is this. Ukraine's prosthetic industry and Ukraine's prosthetic system that currently exists does not need a complete change and revamping. It needs your support, especially expert support, and enhancing. However, there are still organizations and individuals for whom the successful state program, is a threat, because their very operational model is based upon the perceived shortcomings of the government system. So, in the developed countries, it's the government that provides the guarantees of amputee care, of prosthetics, and of the future follow-up and repair. It should be no different in Ukraine. Thank you. Some useful resources for you. And I thank you for your attention.